you. Good morning. Thank you for having invited me. I'm Paola Chesi, actually. This is the pronunciation of my surname. I came from Italy, and yes, I work with Maria Giulia. I'm a researcher at ISTUD Foundation. First of all, sorry for my English. I'll try to do all my best. Anyway, I have a scientific background, and I have been working on healthcare for 6.5 years. With my intervention, I'll try to focus the issue of the use and abuse of English words in healthcare communication in Italy. Basing on our experience, we collect narratives in our narrative medicine projects. We do that in different contexts of care, and so we have many examples of what happens in Italy. I'll try to introduce briefly our methodology of analysis of narratives, where we apply narrative medicine. We used to classify 3 different levels of application. And then I'll show you some example of healthcare communication, focusing on the use of English words. And at the end, I'll try to share with you some our consideration. So I'll start with some introduction on our methodology. This is our group. You already know Maria Giulia, and now you know me, but we are more people. So we have also Luigi and Valeria and Antonietta, and we have a new boy. So he's an anthropologist. We are a multidisciplinary group. So we came from different backgrounds, and we define a common methodology that we try to update constantly. So what we do when we have to analyze narratives, first of all, we have to be at least 2 people who act a sort of blinded reading. And first of all, there is a pure qualitative analysis in which we identify which are the recurring themes and concepts expressed. Of course, we analyze the context. We take in account of the context of the situation. We identify the value and critical elements and the needs and the expectations which come up, and at the end we share our first consideration. Then we combine this analysis with using narrative medicine classifications. There are different possibilities of classification. I won't go through the specific classification. They come from the most important schools of narrative medicine. Just want to underline the importance of the Kleinman classification for us. We try always to identify the element of the disease. So if a narrative is very disease-centered, or if, on the contrary, is more illness-centered. So if it is focused on clinical aspects, or if it's more open to the inner thoughts and feelings and so on. We try to individuate a possible element of sickness. And the other important classification is the Lohner and Robinson classification, which identify the element of coping. And in this way, we are able to understand if a narrative is in progression. So the story of the person is in progression from a moment of difficulty or if it's stable, it's stuck because of the lack of element of coping, or even regressive. And so on. There are other specific classification, but it's not the focus of this intervention. More, we add consideration on the possible forms and style of narratives. We can read more explicit or implicit text, personal or impersonal, factual or symbolic. So we can read more factual narratives with a sort of list of events and data, a sort of chronicle of what happens, with a well-defined actor and time and space. Or, on the contrary, we can read more ambiguous stories with a lot of generalization, with an undefined time and space, and this form could mean the lack of open, a sort of close attitude to open to the inner thoughts. We can find the use of symbolic language, the use of, for example, of metaphors is very common, as well as sayings or dialectal expressions. In Italy, we have many regional dialects, and people use these specific expressions in the narratives. So it's really interesting also try to make this consideration on the language. These are all information that we put together, and they are so in this way. What I want to say is that it's not only important the content of the narrative. Of course, it is important, but also the form speaks, because it shows how the person is, how the person feels. More, we can have a different style of language. For example, we receive a lot of epic and heroic narratives, especially from healthcare providers, because they are influenced by the use of scientific publications, which are full of epic, heroic terms, words like enrollment, failure, survival, versus, recipient, sacrifice. These are all commonly used terms in scientific papers, and this is an epic style. And in their narrative, healthcare professionals tend to use this style. Or we can have tragedies, dramatic narratives, or more spiritual narratives, which can be common, for example, in stories of cancer. Romantic style, common, for example, in narratives of chronic condition. We collected stories from people with multiple sclerosis, and they were very romantic. Love, affects, family were the most important resources for people in facing their condition. Or an ironic style full of cynicism, typical of young people talking about their disease. Or a more didactical and educational style. This is what we could receive. So we apply narrative medicine at 3 different levels. The first level is relational. It is related to personal relationship between doctor and patient. Why narrative is important? Because through narrative you can improve clinical practice. It's possible to reach better diagnosis, a real concordance on the therapeutical project, or to better fit a pathway of care on the patient's need and expectation. And finally, a narrative can be a way to move the focus from the disease to the illness. So from the strictly technical and clinical context to a more, let's say, complete approach, which take care of the living of the person with the disease. The second level is more organizational, and it considers relationships within the whole healthcare facility and within a team of care. The regular use of narrative can improve the working climate in a team care, or it can be useful to rediscover the own professional motivation, reducing the risk of burnout, which is very common for healthcare professionals. And the third level is more systemic. So narrative can have an effect on the whole healthcare system, because it can contribute to reduce situations of conflict. I don't know here in Australia, but in Italy, the use of defensive medicine is increasing more and more, and it's not a good climate, both for patients and caregivers and for healthcare providers. There is a sort of war sometimes. So the use of narrative can contribute to create a more welcoming climate. And with narrative, you can better analyze a pathway of care and find new strategies to improve services, new strategies. To limit the so-called doctor shopping phenomenon, which is one of the English expressions that we use. We don't have an Italian translation of this expression. We talk about doctor shopping phenomenon. And finally, you can know the real burden of illness of a condition. Talking about healthcare communication in Italy, the communication is full of abbreviations, acronyms, and English words. There are almost 9,000 acronyms commonly used in the healthcare communication. Some of these acronyms are in Italian, some others are directly in English. This is a short part of the list. What we have to do with the occasion of this workshop is to analyze our narratives that we have collected in this year. This is a session of our website. We have a specific session on projects. We are copyleft. So when we finish a project, we upload the report with all the results. Sometimes we translate this report in English, so if you are interested, you can go to the website and try to find something in English. Up to now, we have collected more than 6,000 narratives from different contexts of care and different stakeholders, patients, caregivers, healthcare providers. So we try to analyze our narratives to find the use of English words in the communication. So, considering the first level, so the relationship between doctor and patient, these are the most common English words and expressions commonly used in the communication. Words like caregiver, we talk about caregiver. We don't have a specific expression in Italian, or care. Check-up, follow-up, we talk about, but we don't use it so much. Follow-up, day hospital, many settings of care, day hospital, trauma center, breast unit, hospice, and other expressions, transitional care, for example, stress, shock, counseling. Counselor is only in English, there's not an Italian word. Screening, and so on, many other more specific expression connected to some specific condition. For example, in the case of assisted reproduction, a lot of English words, and also in cardiology and pulmonary diseases and so on. This is an example taken from narratives of preservation of fertility in women with cancer. So we collected narratives from women who carried out preservation of fertility before starting chemotherapy or radiotherapy, and narratives from their providers of care. This is an example of an Italian sentence with the use of English words. So this woman says, mi è stato, you can find the translation above. Mi è stato diagnosticato un tumore, ho iniziato la lista di esami per affrontare questo mostro presso la breast unit del mio ospedale. So she talks about directly about breast unit. And the doctor talk about step of the therapeutical plan. L'intervento di presentazione della fertilità rappresenta uno degli step, or pick up, il giorno del pick up, the pick up day. It's only called pick up. Considering the second level, English words among healthcare professionals within a team of care. These are the most recurring English words and expressions. Most of them are linked to clinical research. So all the words like paper, abstract, submission, impact factor, survival, survey, clinical trial are directly used in English. So we say devo fare la submission del paper. This is the common language. Or in clinical practice, we talk about burnout. We don't use an Italian expression. It could be esaurimento in Italian, but it's not used. We talk about burnout, borderline compliance. We do have an Italian translation, which is concordanza, but we use compliance. Target therapy, and so on, aging. And so these are a couple of examples. This healthcare provider talk about compliance, il farmaco efficace, ma altrettanto importante è la compliance del paziente, the patient's compliance. Or he talks about target therapy. Penso che le cure di cui mi occupo potranno evolvere verso le target therapy. This is another commonly used expression. And we come to the third level, English words in the healthcare management. This is the biggest group of English words and expression. So we could say that this third level is the more affected, I don't know, by English. So we have, again, some expression of the setting of care, but also expressions like team. We talk about team or staff, data manager, risk management, decision maker, turnover, briefing, part-time, full-time, and all the expression of costs, budget, fee, business plan, performance, spending review. We talk about vision, mission, and we have the Italian expression which are visione, but we use vision, missione, and we use mission, clinical governance, stakeholder, FAQ, frequently asked question. You can see in the Italian hospital website this session, FAQ. Call center, privacy, ticket, patient needs to pay a ticket to be cared. Fertility Day, this is funny because Fertility Day is a national initiative, a national event to sensitize population on the preservation of fertility, and it couldn't be called Giornata della Fertilità, but it was called Fertility Day. And so on, empowerment, shared decision making, and so on, the doctor shopping phenomenon. These are narratives from administrative of hospitals. They talk about mission, as I already said, or standard. So why all these English words? Probably there are more than one source. First of all, web, because nowadays people tend to search for information on internet before coming to the doctor sometimes, and this figure is a reality. So when a patient comes to the doctor, he already have read about many information and already taken a specific language, technical sometimes, and English. And the use and abuse of English words can come from healthcare professionals because of the scientific word, which is in which there is the imposition of the use of English. And this is also a problem because, as you can hear, we are not so Italian people have some difficulty in learning good English. And so, although the high quality of some research paper could be rejected because of the English. Another source is the management, because nowadays healthcare facilities are considered more and more like companies. So all the management, the business English has come. And also from pharmaceutical multinational companies. So we have all these sources of English words. And of course, we need to simplify. This is a first attempt to categorize these English words. Probably is not complete. It's just a way to see how much the biggest number of English expressions is in the category of processes and organization of care, and also in clinical research. We use many names directly in English. Fertility Day, medical humanities. Maria Giulia teaches medical humanities, and we don't.
What it is in Italian? Umanesimo, medicale, or scienze umanistiche. But the why you say medical humanities is there.
So for sure, we need to simplify. We can use that English words are largely used in the organization of care, and this is linked to a strictly disease approach. It's not an illness approach. It's more focused on clinical and organizational aspects, while the part of bodies are named in Italian. So some final consideration to share with you is that English words are used both by patients and healthcare professionals, and this was a surprise for us because we expected to find a bigger use of English words from healthcare providers, but also patients adopt this language. But patients need to become expert to really understand their condition, the pathway of care, and to relate with the physician of reference. And the use of English words in healthcare is strictly connected to a disease-centered approach, and we need to move the focus to the illness approach. So we should limit this abuse of English words and try to come back to Italian when possible. But we can also say that patients tend to mirror and adopt the clinical and technical language when words are considered direct and close to them, to their condition, familiar to them. And in this case, minimal English is important, for example, for web and scientific communication. And finally, we need to find a balance between the current context, so the use of web, the scientific research, the healthcare management, and then this need to simplify and to understand each other. And so minimal English could be one of the keys to find this balance. That's all. So thank you for your kind attention. Hope everything was clear, but of course me and Mario Giulia are at disposal for any further question. If you are curious to see how we work, you can visit our website and